Hey everyone out there, I just wanted to do a little segment talking about one of the things I see quite a bit is rounded shoulders and neck pain following taking care of little ones, holding babies and feeding babies. So I thought I'd put together a batch of stretches that can help with relieving some of those symptoms. So one of the common problems that happens with holding babies for a long time in this posture that I see a lot in the clinic is we get chronically stuck in this position with rounded shoulders and head down looking at the kid. And so one of the main things I try and teach people in the clinic is if you're in that posture for quite a while, make sure that you're using both arms is very important. It's kind of hard to do that if you're really hand dominant on one side or the other. The other one is doing some of these basic stretches right when you're done feeding the baby and you put them down can really play a huge role later as you things start to accumulate on themselves if you don't take care of them right at the time. So one of the first things that I like to work on is the pecs in the front because they get tight in this position. So that's the first stretch we'll look at. My favorite quick stretch for the pecs is the doorway stretch. Using a 90 position here. If you can't quite do that because of a shoulder injury, you can go a little bit lower. But working on just on the inside of the door frame and slightly leaning forward. And I like to add the neck in with it, so I'll look away down at the bottom corner of the opposite side. And I'll usually hold that for about 30 seconds, 2 sets, and then I'll do both sides. One of the other stretches I like to do is a standing or seated cat-cow with a reach. So I'll sit or stand and work on arching forward with my head down, rounding the spine, and really reaching my hands forward with a pull across the shoulder blades. And then working into the opposite position where I'm rowing back, puffing the chest out, and looking up to the ceiling. And it's very important that your head follows with these postures. For these, I'll often recommend to hold for less, about 10 seconds, and do about 10 repetitions both directions. One of the other big muscle groups that becomes a problem is your big lat muscle as it attaches in the front of the shoulder. And so I like to work on a standing or seated lat reach where I'll reach to the ceiling and then I'll slightly lean, keeping that hip down. So if you're seated, really making sure that hip doesn't rise, but keeping that pressure down. And again, hold 10 seconds, about 10 repetitions on each side. Okay. I also like to focus on 3 main cervical muscle stretches, one of which is going to be 2 on the back and 1 in the front. The one in the front being the scalenes. And if you feel your hands going numb or you're starting to feel like your hands are getting cold, this can be a culprit of some of those symptoms. So holding your hands down at your chest, really holding pressure on your sternum, your chest bone, and then looking up and away at the opposite light. It's very important to keep your mouth shut during this exercise. And I usually will hold that one for about 3 sets of 30 seconds. And then the next 2 are all going to be on the back of the neck. And so I'll hold the opposite arm down or I'll push my hand to the floor while I look straight and away, getting the upper trapezius muscle, or on that same side looking down at the opposite armpit and holding there for about 3 sets of 30 seconds. Hey, that's it, you guys. I hope that you find these useful. I find them useful on a daily basis with kids. They can be very helpful if you're at the desk a lot or anything like that too. But the high repetition of childcare and being in that posture is a very common thing to find headaches and shoulder and neck pains. So these can be really quick and easy to implement. And once you do them for a couple of days, they kind of become general practice. So I hope they help you out quite a bit. Thanks.